Thanks for joining us today. We are really pleased to welcome Kaylee Matheny, who just joined the faculty at the McCourt School of Public Policy at Georgetown. Kaylee is a sociologist who uses a whole variety of different methods to study issues around education and socioeconomic inequality. And we're going to get to hear just a little piece of that work today. Kaylee has said that questions throughout is fine. So whenever you have them, bring them. And we are pleased to welcome Kaylee.
Thank you, Sarah, for the introduction. As Sarah so generously introduced, I'm Kaylee Matheny. I'm a brand new professor at the McCourt School of Public Policy in DC, and I'm going to be presenting some work that I did as part of my dissertation, but is also part of a larger book project that I'm working on right now about how low-income folks have barriers to entry for college and then also barriers to completion. So this is a small part of that work. And as mentioned, I encourage questions throughout. Feel free to ask clarifying questions. You can also ask substantive questions, and sometimes I might be about to preview exactly what you were going to ask. So sometimes this can be perfect and timely. And then the work today is titled The Triple Burden, Women of Low Socioeconomic Status and the Binds of Caretaking, Work, and College. So just a bit about motivation, and I'll also tell you a little bit about me as well. So my big research agenda is really centered around social mobility and how we can create an opportunity economy and how we can think about improving opportunities for social mobility for folks who are at the bottom of the socioeconomic ladder. So to that end, I do research on understanding people's experiences with social institutions, which will be is the bucket that this project fits really well into today. But I also do have some work evaluating and improving policies, combating structural disadvantage, as well as identifying possible and asset-based interventions. So those are some other pieces of work that I do as well. And as Sarah mentioned, I like to identify as a methods omnivore. So my dissertation, for example, included quantitative descriptive, causal inference, and also qualitative work. So the work you'll be seeing today, this is a mixed method study, and it includes quantitative descriptive work as well as qualitative interviews. So we'll start with a couple of stories to dive in. So this is Rosie, one of the participants in our data. This is her at age 15. She says, I definitely want to go to college for at least 4 years. You know, I want to get that college degree, the 4-year college degree, and I really want to make a good job with good money. Because my mom couldn't really do that since she got pregnant. She didn't have a decent job and she couldn't go to college. I want to do that for her. So this is Rosie at age 15, and we're also going to hear from Jasmine at age 16. So Jasmine says, I work very hard in school. It's very important because I don't work just for that day. I work for my future. So I need everything that I'm working on to be good. So when I come to the process of applying for college, I don't have to be, I should have done this, or I should have done that. I don't have to be angry that I didn't do something. Like the careers after college, they're good. HBCUs have good jobs related to criminal justice, crime scene investigator jobs. They're high in those jobs. They rank high there. So you can see that these two young women at ages 15 and 16 are already thinking, they're sophomores in high school. They're already thinking about where they want to go to college and what they'd like to do long term. So they're already imagining themselves on a college going track. And to zoom out a bit, so there's a good reason for why they're on this track. So one is that, as Jasmine points out, college can lead to a good job. And in fact, the college wage premium increased steadily between 1950 and 2000. So there actually is a really good economic reason for going to college. We also have the reality that essentially you can divide the US into 3/3 of people. There's the folks, there's the 1/3 who never start college. There's the 1/3 who start and don't finish. And then there's the 1/3 approximately that do finish. But we have this big 1/3 of folks. This is a really large percentage of folks who start college but exit before earning any credential. So it's a large percentage of folks. And then finally, that stopping out or taking time off from college is associated with greater student debt, with longer degree timelines and a lower probability of attaining a bachelor's degree. So if you stop and start, you have a lower probability of attaining some of those goals that you have initially set out to do. And there's been a lot of at least rhetorical concern for boys in higher education, because if we think about who is more likely to start college, those are women. In fact, there are increasing shares of women among bachelor's degree earners. And so when we think about we're worried about enrollment in college, a lot of the rhetoric has been about improving opportunities for boys, which is a very worthy cause. Let me be clear about that. But these headlines from the Wall Street Journal, the New York Times, the Atlantic tell us colleges have a guy problem. The male college crisis is not just an enrollment, but completion. A generation of American men give up on college. I just feel lost. And my personal favorite, poor girls are leaving their brothers behind. And I'm going to show you the exact statistic that this article quotes. So that poor girls are leaving their brothers behind article specifically cites that low-income women are 50% more likely to earn a bachelor's degree than their low-income men counterparts. And that's true, and that's actually what this graph right here is showing you. And that's based on these numbers right here of that 12% of low-SES men end up getting a bachelor's degree compared to 18% of low-SES women. So that's that big 50% difference right there, from 12 to 18%. But both of these are quite low compared to the high SES counterparts for each gender group. So there's a couple of assumptions that I really want to trouble and that I want folks to leave thinking about. And one is, who are we thinking about as our counterfactual or our comparison group? So for example, when we think about, poor girls are doing so great in higher education, we're still looking at this 18% number. We're comparing it to this 12% number, so it is higher than that, right? But it's not as high as it would be if they were born in households of higher income. So I want to trouble those comparison cases. And actually, if we flip it on its head and we think about what intersectionality theory would tell us, is it's not about low-income women compared to low-income men or high-income women, but it's really about where low-income women would be if they were not held down by the binds of gender and class inequality. So just flipping this a little bit and looking within gender groups at the SES inequalities within gender groups, just to kind of drive this intersectionality point home, I want to point out here that if we look among men and at socioeconomic differences among men, we find that starting college accounts for 70% of the socioeconomic disparity in college completion among men, and persisting only counts for 30%. So really the story for men is about college enrollment. The story for women is a little bit different. So here it's actually flipped on its head, where starting college only accounts for about 40% of the socioeconomic disparity among women, and persisting accounts for 60% of the disparity. And that's one of the things, or that's the primary question that we're investigating in this paper. So what is it about persistence, and what is it about this persistence gap that is so much larger for low-income women compared to low-income men and high-income women? So popular discourse and policy interventions, they privilege these narratives of, things are looking bad for men. And as I mentioned, well-intentioned and well-reasoned. But they're less concerned with women like Rosie and Jasmine, who are working hard in school, who are already imagining themselves on a college-going path. The one thing I want to bring up here is that although women indeed on average are achieving, low-income women are overlooked in these narratives that look just at gender or just at class. Low-income women's triple burden, we call it, which are the binds of caretaking work and school, caretaking work and school, are work together to shape the experiences that low-income women have, uniquely compared to their counterparts by gender and class. So the research question here, how do SES and gender together, not as separate constructs, but as a construct together, shape college persistence? And the data that we use for this is from the National Survey of Youth and Religion, which is a longitudinal nationally representative survey. So it includes young people from the ages of 13 to 17, starting in the year 2003. And so roughly the 1985 to 88 birth cohorts, and looking at how those folks fare over time. So it's nationally representative. It's longitudinal. It takes place over 4 waves, from when those people are 13 to 17 to when those folks are in their late 20s up to 30 years old. So we have data that's collected from 2003 to 2012, but we also do a match with the National Student Clearinghouse to get educational outcomes up through 2016. So we're actually able to track them and how they do in school even longer than the initial study did. We have matched interviews for the national representative survey data. So there are about 3,300 people in the survey data, and there are 330 people in the interview sample. So about 10% of folks in the survey sample have interviews, and then up to 4 interviews for each of those folks. As well as the matched enrollment data from the National Student Clearinghouse. So we've got some really robust data to investigate these trends long term. And then for the longitudinal interviews, we focus on 3 subgroups. So we're really interested in understanding experiences for low-income women. And so we take both groups of comparison. We take high-income women and low-income men and look at how their narratives might be different. And one thing I'll point out.
Kaylee, who collected this? Anybody else ever heard of this survey before?
So this is from the University of Notre Dame.
Where?
Notre Dame.
Oh.
Yeah. And this is, I think, actually a really sort of a best kept secret. These data are really great, but I think people get off put by the word religion in the title. And indeed, there are a lot of religious measures, and a lot of the interview, for example, is about religion. But these interviews are about 2 to 4 hours long, and they cover a lot of ground. So it's not just religion, but it's also school and family and where you're living and how you feel about different political and social issues. So they cover a lot of ground. And as I mentioned, great for religion, but also really great for other questions as well, as I talk about here.
Is there a reason not to include interviews for high SES men?
So the reason that we didn't is just because we were focusing on low SES women, and so it was kind of like the direct opposite. And I'll show you some of our qualitative findings that I think are going to sort of drive home why the focus on these groups. Yes.
Defining socioeconomic status here?
Great question. So our socioeconomic status variable is a composite variable that we created based on several different measures of income and wealth. So the way that this survey collects income is it's in buckets of $10,000 up to $100,000, and then and then it's just $100,000 or more. So not the absolute best income measure, but we include that. We also include both mom's education and dad's education. We include whether the family owns the home in wave 1 as a measure of wealth. And we also include from ONET 1 to 5 occupational status codes as well. So all of that gets baked into our socioeconomic status measure. And so each individual in our survey data is assigned a value on a continuum roughly from -3 to 3, with 0 being the average. Yes.
So in that metric,
Yep.
is it just a binary? You're either low or high?
Great question. So for the survey data, it's just where you sit in that continuum. For the interview data, so we do break it up into groups based on terciles. So there are low, middle, and high income folks, and for this part of the study, we focus on only those interviews with women at the bottom 1/3 of the SES distribution, men from the bottom 1/3 of the SES distribution, and women from the top 1/3 of the SES distribution, just to try and get a little bit more leverage on more sort of polarized differences between groups, and also to kind of focus our energy as well. So, this is just looking at these groups leads to 142 participants with a total of 356 interviews that I had eyes on all of those. And so, that's of course a lot of data to parse, and we were able to find pretty robust patterns with just these folks, but really great questions. So this is, as I mentioned, a descriptive, quantitative, as well as a qualitative interview project. So the analytic strategy I use here is just based on logistic regression and negative binomial regression. So here's the logistic regression model where for the first set of results I'll show you, it's just probability of dropping out or stopping out. With the continuous measure of SES, as I talked about, woman, which is a binary indicator for woman or not. And we also use, so the initial measurement of gender was based on what the parent reported the child was in wave 1, but there were 3 cases in survey data where the child later on gave a different gender than the one that their parent initially identified, and that's the one that we use. And then an interaction term between this binary woman or not and continuous socioeconomic measure. Yes.
Could you just talk about why you opted to use a continuous measure of SES in this case? Because I guess like that includes quite a lot of different things. And I'm wondering if you did it using sort of other measurements of SES and found anything.
Yeah, so we did look at parent education, and we also looked at household income. But as I mentioned, the household income variable is a little bit complicated because there's so many kids that get dropped into the 100K plus bucket. But also those measures are a lot coarser than a continuous measure base that like kind of has a lot of different factors of SES baked in. But it's a really great question, and it's something that we did look at how correlated, for example, the different factors were that we were putting into this. There were some things that we opted to not include. For example, we originally thought single parent families as part of the SES measure, but then we decided to take that out just because we were already capturing income and we were already capturing parent education. But we do, and the multivariate models, we do include an indicator for whether the parents were married or not. So it's still in there, but it's not part of the SES measure. So we did look at particularly, not so much for the job when it's in the SES measure, but it's not one that we looked at. We did look at parent education and parent income, and it really seemed like the clearest story was both together. And then for the qualitative analysis, we first were looking, this project actually began, we were not really looking at gender so much, we were just looking at reasons that people might stop out of college. So that was our initial pattern, our initial descriptive code. And then we started to unpack that code a little bit more as patterns became more and more apparent to us as coders. So for example, this reason for stop out led to us identifying this pattern for caretaking, and even this pattern for caretaking became something that we began to disaggregate because it did not look the same for everyone who reported a case of caretaking, and I'll talk a little bit about what that looks like. But just as an overview of the quantitative findings before we dive into the qual stuff. So this is the binary outcome of ever disenrolling, and just to orient you to the graph here. So on the y-axis, we have the probability of ever disenrolling. These are estimated probabilities from the logistic regression model. And then on the x-axis here, we have the continuous measure of socioeconomic status. And men are going to be in blue and women are going to be in orange. First glance, you're like, there's no difference here, and that is by design. So essentially, low SES men and women are similarly likely to disenroll prior to getting a bachelor's degree. This means that once they enroll, both groups are likely to disenroll with a high probability. So for example, looking at point estimates at the 10th SES percentile and the 90th SES percentile, we see that low SES women, who are always going to be the reference group anytime you see a bar graph here, they have a 0.86 probability of disenrolling after enrolling. And low SES men, similar at 0.85. No statistically significant difference there. And then we also see that low SES women are significantly more likely to disenroll than high SES women and high SES men. Yes.
Have you done this looking at 2-year degree attainment? Because the meaning of disenrolling feels different if you actually graduate with an associate's versus not.
That's a great question, and we have thought extensively about this because particularly for men, and So essentially, if you start college and you leave with a 2-year degree, we count that as disenrolling. If you start college or you start at a degree granting, so this is all degree granting institutions. If you start at a degree granting institution, but then you go a different pathway and you do something that's more applied, you're still counted as disenrolling. So this is basically, do you disenroll prior to getting a BA or not? And there are challenges with that measure in particular, because you'll see when we get to the qualitative data, a lot of the reasons for disenrollment are due to bad fit, which means that a bachelor's degree is not the right fit for that participant based on their occupational goals. And we can talk a little bit more about what that means. But we did look at that, but we decided from sort of an overarching story about whose degree attainment are we worried about. So often the conversation is about bachelor's degree attainment. And so that's the one we focus on here. But the real story here is about repeated disenrollment. And so what that actually looks like is that, so both low-SES men and low-SES women disenroll from college. Both groups disenroll from college, but low-SES women go back. They go back and then they leave again. Whereas low-SES men, they have a smaller number of predicted disenrollments. So oftentimes actually they leave and they don't come back, and a smaller share of them actually come back multiple times. Yes.
How does change of schools count?
So changing schools does not count as disenrolling.
That's all.
Yep.
Thanks.
Great question. Yes.
How many years were following?
So the students are followed from the first time they start college. So for example, if you take a gap year, we don't count that as disenrolling. But once you start at a degree granting institution, it's counted as a stop if you are out for a semester or a quarter, if you started at a quarter.
I'm sorry, I mean, how long in calendar time?
Yes. Sorry about that. So we look at folks from the first time that they start college up through 2016, which these folks are starting college oftentimes around 2005, 2006. So it's about 10 years of data, depending on when they graduated, because it was ages 13 to 17 at the first wave. So different normative starting. Great question. And so what that looks like from estimated probabilities at the different poles of the SES distribution is that on average, low SES women at the 10th percentile of the SES distribution have a little bit more than 2 predicted periods of stop out, or 2 predicted interruptions before bachelor's degree attainment. And low SES men have fewer predicted interruptions in comparison. And that is statistically significant at the P is less than 0.01 level. And then, as one might imagine, high SES women and high SES men also have very different rates of stop out. And the 2 greatest differences here, as previewed at the beginning, looking at the NELS data from 2002, is the group with the greatest propensity for stop out is low SES women, and the group with the highest propensity for stop out is low SES women, and the group with the lowest propensity for stop out is high SES women. And so we actually see these very, very different experiences by class that is also very specifically gendered. So why are women stopping out, and why are they doing it so much more? And this is where our qualitative interviews come in handy. So this is just a graphical way, or a chart way of looking at our qualitative data. So we looked at every single one of the cases that we had introduced, and we looked at whether they started college, whether they disenrolled, and what their reasons were for disenrolling. And so among our interview sample, we do have similar rates of disenrolling from college, so disenrolling from college. So very high and very similar across both men and women in our low SES sample. And you can see that high SES women also a lot less likely to disenroll. So this sort of passes the sniff test per our quantitative findings. And then we also identified the reasons for disenrolling. And what we found is that caretaking is by and large the reason that low SES women provide for disenrolling. So they're a lot more likely to disenroll. So like looking at this column here, among low SES women who disenroll, almost half cite caretaking as a reason for disenrolling at least once. And among low SES men and high SES women, very few, 12% and 15% cite caretaking as a reason for disenrolling. Yes.
They can pick multiple reasons, or they.
So the way that we coded this is if caretaking was part of the equation, then we gave them a caretaking reason. So some of them will say like, oh, I had financial issues, but I was also juggling childcare, and that person would be in the caretaking group here.
See, that to me sounds like a money problem, like not being able to afford childcare, but.
Yes, but who can't afford childcare? And so that's never a reason low SES men cite, for example, as needing to stop out, but it is specifically a reason that low SES women would cite for needing to stop out. Yes.
If someone stops out to contribute to family finances, is that considered caretaking, or is that considered?
That's a great question. We do have a case like that, and I counted her as financial. Because there were the caretaking that we were coding for here was really physical, like you need to be there to take care of your little sister, or you need to be there to take care of your mom who lost her sight, for example, or some of the cases. Yeah, great questions. So this is not to say that these things can't overlap. In fact, they often do. And we'll see a case of overlap in just a second, but yes.
What's the difference? Childcare and college.
Yes, so love it. No, that's great. So caretaking is itself one version or one encapsulating code, but in caretaking there are several different parts or pieces of caretaking. The one is familial care work, which is caring for parents, siblings, and other relatives who require supervision and support. So again, not a financial reason in and of itself, but more of a I need to be there physically to care for this person. Parenthood, leaving for birth or parenting, and child well-being. So moving school districts or moving to be near family to support care work for children. So 3 cases to unpack here. So we'll use the case of Amelia for familial care work. And Amelia at age 21 says, my mom had a baby in 2005, so she's talking about her sister, who had a heart condition, and my sister's really low on oxygen and stuff, and so she can't go to regular daycare, and I've been watching her since she was 3 months old, and she had just turned 3 years old in June. And so that's the main thing. I've been watching her every day. I graduated high school in 2006, and now I'm going to college, taking night classes so I can watch my sister during the day. And she's actually having open heart surgery in July, like on the 17th of this month. I think college is so stressful. And if you're living on your own, you have to work to do anything, and you have to have money. So you have to work and go to college. So it's really challenging sometimes. So you can very apparently see the triple burden right here in what Amelia is telling you. And then in a follow-up interview with Amelia at age 26, she says, I have been trying to go to school since I was 19. And I had to do it off and on at the local community college because of money, and then because of classes that I had to drop because of family issues back in 2008. And we can look back at this interview that happened in 2008 and actually see what was going on. So her sister, who was born in 2005, was 3 years old at this age 21 interview. So these were her family issues, which she cites later in the interview as well. Before I had financial aid, it affected my completion percentage at the local community college, which then affected whether I could get my financial aid or not there. And so I stopped going there because I couldn't afford the 20 credit hours that they wanted me to pay out of pocket to get my financial aid back. So if you just administered a survey and you asked Amelia, circle your reason for exiting college, Amelia would probably circle finances. She is talking about financial issues here. But the root of those financial issues was because she had to leave and take care of her baby sister who had had surgery right before or right after this first interview took place. And so it's actually really digging into these narratives and saying that what Amelia is talking about is finances, but it's rooted in having to exit college because she had to take care of her baby sister. So that's trying to complicate some of these measures that we might use, such as financial challenges. And none of the men that that the interviews covered had similar challenges. They had financial challenges, certainly, but it was never because they had to leave school to take care of a sibling. So the second type of caretaking we identify is parenting. And so here's Danny. So this is from the same interview. At age 23, Danny tells us, I never wanted kids. I'm very good with children. I just never wanted kids personally for myself. I wanted to get married before I even thought of kids. So you can see Danny already has this kind of idea of what a normative emerging adulthood looks like. I wanted to get married before I even thought of kids, if that even happened. Move into a place, it was all mixed matched backwards. I wanted to finish college, you know what I mean? It's all different, but I'm still doing it. And then Danny at age 23 again, here later in the interview, she says, I started college during my pregnancy, actually. I believe it was in August of 2010, I'm pretty sure. And I did 2 semesters throughout my pregnancy. And then I did 1 more after my daughter was born. And then it was like, I just need to take a break because this is too much right now. I'm like a sponge. I love going to school. I do. It's just when I'm in school, I need to be 100% focused. Like, I don't like half-assing, you could say, because then it feels pointless, you know? And so here again is another example of where parenthood was a critical point for Danny to consider whether or not she could continue taking classes. And it all just became too much. And then finally, we have this case of moving for children's well-being from Mari, who is, in this quote, age 26, describing her move from New Orleans and where she was enrolled in a bachelor's degree program at Tulane. She says, I moved to Texas, post-Hurricane Katrina, to have better opportunities for my kids to get an education. You know, the schools in New Orleans aren't so favorable. The schools where she is in Texas are much better. I mean, they're not 100% perfect, but much better than where I come from. So I like the schools and being out here. You actually get an opportunity to see what the American dream is. I paid my way through college. I got my associate's degree and I found a career that I love and I fought until I finally got into it. Finally, someone gave me the opportunity, a chance. Because I'm trying to enroll in school now to get through college and finally just get my bachelor's. And so this actually is also a great quote to justify the focus on bachelor's degree attainment as the core crux of interest as well. You know, even Mari here gets her associate degree, goes into the workforce, finds it doesn't have the degree returns that she anticipated, and is still like, I need to finish my bachelor's degree. But she left her institution in part to give a better life for her kids. Yes.
Are there any partners involved in this?
Great question. We have not mastered immaculate conception. So you can imagine that a lot of these low SES women are having children with low SES men, and indeed they are. But most of these women are single moms. Their low SES male counterparts are not so much in the picture, or if they are in the picture, are working to provide financially, but not so much personally. In fact, there are a couple of low SES men interviews that we analyzed where the low SES men outsource the care work to their girlfriend or their mom. So if they have a kid while they're in school, they're able to say, oh, I'm able to still go to school though, because my mom is going to take care of my son. So that was
involved with these people too, Mari?
So Mari's children's father is not in the picture at all. Yeah. Yes.
Do you observe any cases of low SES women who had this triple burden who then also finished their, like, who didn't stop out?
There was maybe 1 or 2 cases, but very, very rare.
Yeah, I mean, I would imagine.
Yeah. And each of the cases that I showcased here, and the 2 cases that we'll follow, because we'll find out what happened to Rosie and Jasmine, and we can all probably infer based on what we've heard so far. But all of the cases that I showcase here are all people who set out to finish a bachelor's degree and who did not end up doing so by 2016. So back to Rosie. So this is Rosie, who we saw at age 15, who really wanted to go to college and whose mom ended up getting pregnant with her actually and wasn't able to finish. So Rosie is asked by the interviewer, are there any kinds of people that you really look up to or not really? And Rosie says, my mom. My mom did almost similar as to what I did. She didn't get as far as in college as what I did because Rosie did go to college, but she didn't complete. But my mom raised actually me and my 2 sisters by herself, and she's doing very well for herself. So I think I'm looking up to her, and I'm also trying to make it on my own, just similar. So Rosie, who initially, when she was asked this question, the first wave of the interview, she didn't say her mom at all, actually. She said that she didn't look up to her mom because her mom didn't go to college. And who she looked up to was her aunt, who did go to college. But now here at age 25, Rosie is seeing her mom's story in her own story. And then we also have Jasmine, who is asked at age 23, and this is a point I will remind everyone, these are secondary data, and I did not design this interview guide. On the whole, do you think your mom is happy with how you turned out? And Jasmine says, I think she's happy with the maturity level that I have and my ability to take on any task or any problems that come my way. She knows I can hold my own, and she's happy with that. I think she would have wished that I would have finished college before I had kids. But all in all, she's happy that even though I have so much responsibility at a young age, I still take care of the things that I have to take care of. My children, I know that I've never been kicked out of my home. I've never got a late notice. I don't get red flags on my rent. And my lights are on. And I don't ask her for anything either. So she is definitely proud of me growing up when I needed to. So some implications from this work. I argue here that sociologists have posited the double burden, which is women's simultaneous responsibilities both at home and in the workforce. And we see that this is also the case very much for young women who might otherwise be experiencing emerging adulthood, but who also now have to juggle school as well in order to have a better life for themselves and their kids. So it's really a triple burden. It's not a double burden. And then motherhood also delays entry to degreed careers and extends the timeline of higher education. Even assuming you're able to get a degree, it still lengthens the time it takes to do so and extends the time it would take for you to begin getting returns on your degree. It's also important to consider multiple axes of marginalization. It's easy to look at some of those headlines I showed you guys earlier and say, low-SES women are fine. We don't need to worry about them so much. And so I argue that's actually not the case at all. And then also emerging adulthood, which is this new emerging stage of the life course, is very classed. And this is not necessarily a new contribution, but it's something that is made very stark in these interviews. These are women who, compared to the high SES women, who I didn't show any excerpts of today, but compared to the high SES women who are able to have continuous enrollment right after high school or after a gap year, who don't have caretaking responsibilities or don't to the same degree that their low SES counterparts have, those folks get to experience emerging adulthood. But there actually really is no emerging adulthood for low SES women. So some of this work has been featured in the Sociology magazine Context, as well as an op-ed that I wrote with my co-authors. So thinking about the importance of reproductive access for folks so that they have more agency in the process, but also recognizing that some women, would still choose anyway to be mothers. And so also recognizing that making higher education more accessible for student parents is also a really important implication here. Some takeaways: people, especially those who can give birth and for whom social norms imply caretaking, need to have as much agency in that process as possible. And that childcare is essential not only for women's equal labor force participation, but also equal opportunity in higher education. And that there are some implications for colleges to be able to accommodate students as well. And actually many community colleges are doing an excellent job of providing some of these services, and it would be good case studies for future work. Thanks, everyone. Please.
What helped them finish? Amongst your group, you talked about dropping out, whatever, what were the key things that helped those who were on this path finish? Was it relief? Was it financial help? Was it childcare assistance from parents? What broke the triple, allowed you to get around the triple bind?
So being able to outsource childcare was a big one, especially for the low SES men and the high SES women that had kids while they were in school. I'll go back to this chart because I think it's really helpful for orienting. So you can see that even though many, half of the low SES women who stopped out left for caretaking, there are a couple of men and a couple of high SES women. But those folks, the men ended up pursuing a more vocational track. But the high SES women who had kids and still 2 out of those 3 still finished their degrees, in part because they were able to outsource childcare to their parents. Their parents really both financially but also interpersonally supported their degree pathways and became sort of second parents to their children. Yes.
Curious also in the context of the kind of religious interviews. So you have a lot of stuff about people who did have kids. I'm very interested in the people who did it and kind of why they did it, how they did it, the extent to which it was part of that story, and the extent to which that was asked.
Yeah, so this was also sort of among people who were like the early 2010s is when they were typically in college, and almost none of them. So for example, I showed you guys Danny, who talks about the potential of having an abortion at other parts of her interview. And she mentions that that's not something that she would have ever considered because she was so, both from a religious standpoint, but also, that was just something that she believed was a commitment to her and to her family and to her child. So it wasn't something that featured very heavily in their interviews. And for the people who didn't have kids, there's actually, there was one case of a low SES man in the interviews who talked about his girlfriend had had an abortion when he was in college, and so that did not contribute to his stop out. But that was really where that really came up, and that was part of that story.
Yes. Just in terms of the high SES women, single parent families were, and you also mentioned the high SES women where they were able to like double up with their parents in terms of childcare. Were they also similar in terms of family structure, or what they had different structure?
Yeah, so a lot of the low SES women either were from themselves single parent homes or had moms who had remarried, but a lot of the high SES women were from 2-parent homes, and both of those parents were their original biological parents. So that's kind of the by and large family structure that I display here, but I'm not sure of exact proportions. Yeah, it generally trended with single / step parents for low SES women. Yes.
In terms of their partner, like did the low SES women groups and the high SES women groups have a different rates of having their own partners?
Oh, great question. I think actually for the 3 or for the 2 high SES women who did have kids, neither of their partners were involved either. Yeah, or who left for childcare reasons. Actually, another one did have a kid but didn't have continuous involvement. Yes.
What did bad fit mean? Because I'm struck by how few of the low SES women had like bad fit as a reason for.
Yeah, so bad fit, I'll give you a couple of cases. Bad fit is basically a bachelor's degree was not the thing that you either started out trying to get or that you decided you needed when you were in college. So one of the high SES women, for example, exited early because she wanted to be a photographer and decided she didn't need a bachelor's degree in order to be a photographer. And so for low SES men, that often looked like starting a vocational program and then either finishing that or not, but altogether not getting a bachelor's degree, but doing so starting at a degree granting institution. Yes.
Of the women who dropped out for childcare, do you know what share was like own child versus child of family member?
Yeah, so the childcare, all 4 of these women are their own kid. The other, so like Amelia, for example, for taking care of her baby sister, that is family care. So that, and then there's like a taking care of a parent that's also coded under family care.
So do you think it's usually like the two-thirds are your own children? Like,
I think it's too hard to say with numbers this small, but I think because childcare and child-driven move are both based on your own kids, and so I think that by and large it would be your own children that would like inspire that move. Yes.
Do you have any information about borrowing, maybe specifically student loans, and then also sort of monetary transfers from parents?
We don't have that systematically. There is in Wave 4 a question about whether they have debt, but that could also be any kind of debt. So we don't have good measures of that. We only have the evidence from the interviews when participants say, oh, my parent paid for this or my parent didn't. And again, very closely tracked along class lines. Low SES women were very often financially responsible for their own higher education. So for example, Amelia talking about, you know, I've accrued all this debt that I now have to pay back in order to re-enroll, and that's a her problem. Whereas some of the high SES women, their education is either entirely financed by their parents, or when they encounter some challenges, they just move back home, or they have those covered by parents. But that's more from the interview data and not systematically collected. Yes.
I have two questions. One is, I would love to hear more about the low SES women and the low SES men who completed their bachelor's degrees and what we can learn from those cases.
Mhm.
And then second, the story that we've been really focused on here is the qualitative story about just disenrollment as a sort of dichotomous event. And what you showed us quantitatively is that's not how people experience it. And so it would be great if you could talk to us more about what does it look like qualitatively to have this churning in and out of college.
Yeah, and some of that is like, I'll go back to Amelia's quote here. She talks about you know, having to go to school off and on due to care work, and that's something that a lot of the care work quotes did indicate was, you know, I went for a couple of semesters and then I had to take time off. I started back and then I had to take time off because it was just too much. So there is a lot of that in the interviews.
Just to clarify, like, so what allows them to re-enter, right? So I get the leaving part, but
What allows them to
how do they go back in, and what allows that to happen, and how does that mean they get derailed by the same thing again, or they get derailed by different things?
It seems to be the same thing, but this is actually a great question. I think for a follow-up study, just because that was not something that these interviews were specifically designed to capture. So this is almost the best I can tell you, and with this level of granularity. So we don't, for example, it would be great if anybody, including myself, would be interested in doing a study on actually like when people stop out, what that particular reason is, and actually like looking at it at a more time basis, because these are also interviews that we kind of had to piece back with the administrative data about enrollment. So where they say they went and when they say they went there. And so we're having to do a lot of that extra work that a study design more intentionally designed to capture this would do a much better job at. So it's really difficult to say exactly like what reasons were, which is why we sort of like give a broad code to care work, and which is why we code even things that are like, that look financial but are very clearly care work are still care work in this of the paper. So, but that's a great question. And then for the women who go continuously, most of them don't have kids. And so that is a big part of the story. You know, we tried looking initially at like types of institutions that people go to. So like if you go to a high retention, high graduation rate four-year university, are you less likely to stop out? But quite frankly, at least for the qualitative sample, so few of the low SES women go to those types of institutions that it's really impossible to disaggregate. Most of these folks are going to community colleges, and so are experiencing both promises and challenges articulated by the women in this study. Yes.
I don't know if there's any regional variation in the study, because I've noticed most of the states that have been like mostly southern or Midwestern states. Because I'm also wondering about like access to contraception in those states and like education around that in these like locations.
Yeah, that's a great question. So we don't actually look at the states that folks are from. We do have region, and I don't think I ever like ran an interactive to look at that. It's something I certainly could do. So I will add that. Actually, I'm going to write that down. We do have like an urban city code, and that doesn't seem associated with it, but I'll write region as well. Other questions? Yes.
So if I'm a policymaker listening to your talk, what do I take away as the implications for policy and levers to improve?
And say that last part again.
To improve outcomes, what are the levers that we should be thinking about?
Yeah. So I think the orienting principle is affording agency to people who are often saddled with caretaking roles. And so that is disproportionately women. There's also been some research recently on like oldest daughters, which is also a piece of the puzzle, but thinking about ways that people can get resources to support the things that are keeping them from continuing. So people who can get resources to support either like, for example, in Amelia's case, coming back from the debt that you accumulated by having to withdraw. So having special grants for that would be one implication. Another would certainly, we have some op-eds about the importance of abortion access as one lever, but certainly not the only one, because again, most of these women would still have chosen to become parents anyway, just given moral commitments. And so thinking about ways that it can be easier to have those folks have childcare. So childcare on campus would be one implication as well, and other supportive childcare structures, like vouchers, for example. Also just broader childcare access, because even if you have a center, it's so hard to get in.
Did any men talk about having to pay child support?
Not one.
Okay.
Yes.
Any implications for Pell Grant policies or student loan policies, like with the stopping out and having to catch up on credits and those kinds of things?
I think, I mean, my line is that the Pell Grant isn't large enough given rising tuition costs, but I think specifically for looking at the intersection of care work and college entry and completion, I don't know that. It seems like there would need to be a secret third thing or something that would be made to specifically address that particular challenge, in part because it's not something that equally affects everyone or even all low-income regions.
Did anybody in your samples say that they got any child care subsidy assistance?
No, nobody described that, but it also wasn't a question in the interview guide, so it's always possible it happened and wasn't elicited.
CCDFs don't care about school, they just care about. I understand.
Yes.
A sense of the distribution of types of universities attended, so how many are like private, public?
Yes, so a lot of the low-SES folks are attending either public community colleges or for-profit institutions. That's actually a fair number, is the for-profit institutions. So they'll, one person even talked about their school dissolving while they're trying to get their degree. And so that is also difficult and challenging to read, but very few of them are four-year institutions. I think out of the low-SES women, maybe 2 go to a private four-year, and both of those continuously complete.
Does the stop out rate look different at the school?
We haven't looked at the for-profit versus nonprofit dichotomy, but anecdotally, I would say yes. Good question. Yes.
Well, I'm not sure if I remember it earlier. You just mentioned the data is from Longitudinal survey with 4 waves. So I'm wondering if there's any nuanced information about the trajectories of this and enrollment from the qualitative interviews.
Yeah, so that's a little bit of what we're able to get at, like with Amelia's case here, where we have this story from her at age 21, where she is giving us what later becomes cited as the reason for her stop out. And so that's one of the ways that we're able to leverage the qualitative interviews, is to be able to connect those dots in participants' narratives and actually see over the long term, what was it that they cite as a reason for stop out. And then also compare their original goals, like Rosie or Jasmine's, to what ends up happening for them, which is not completing college. Nobody's asked me the question I get the most often about this paper.
Which is?
Race question. And actually, I've got a great answer, so I'm going to tell it to you.
So what about race?
Yeah. So what about race? Okay, we like low-income women, like I get it, but aren't most low-income women women of color? And then also, like, what's going on? And actually, so there really was no racial difference in the 20 cases that we analyzed for low-income women. These are white women, these are Black women, these are Hispanic women, these are Native American women, these are Middle Eastern women who are in our low-income group. There are both white women and women of color in each of those very small subgroups of family care, child care, child-driven moves. But what I will tell you is that both of these low SES men and all three of these high SES women who leave for care responsibilities are people of color. And so there is an additional layer of race that does map onto some of this care work that makes, for example, one of the low SES men who has to leave to care for his mom. He is a Black boy, the older of two, and his mom loses her sight. And so he goes home, he leaves college, he goes home, and he starts taking care of his baby brother and his mom. And so one, there is no older sister to do any of the care work, but two, it is also something that is expected of him and his family because it is only the three of them. And so him being the older sibling is the one who is tasked with that work. The other low SES man who leaves college and stops out for care work is also actually a foreign national who was included in the sample, who was trying to balance post-secondary attendance in Columbia while also balancing childcare. So we've got absolutely no white men who leave for care work, and also absolutely no high SES white women who leave for care work either. These are also all women of color in the high SES women.
Are there any other good questions we didn't ask?
That itself is a good question, but I can't think of any offhand.
Any bad questions from the audience?
Anybody got a bad question out there?
Yeah.
At the very end, you skipped over something that you had about excused absences, and I didn't read it, so if you could just put the last slide. Or tell us what it said about excused absences.
Oh, okay, yes. So implementing excused absence policy. So this is also just part of the so like one, to allow women who, for example, might need to travel across state lines to access abortion access, or for women who have to arrange childcare or who have last minute challenges with arranging childcare, having excused absence policies that are more accommodating of student parents, or just policies in general that are that acknowledge that student parents exist and that they are part of the classroom environment and ways that classrooms can accommodate them more readily. I think is the implication for that. Yes.
You mentioned that some community colleges are doing a really good job at that precise thing. Could you give some examples?
I would love to if I could think of any. Yeah. I know I've read about some, but I don't have any off the top of my head.
Great. Seeing no additional questions, good or bad, let's thank Kaylee for this research.